Good afternoon and welcome to the weekly Department of Behavioral Health update. I'm going to jump right into it. COVID is spreading across the world. It continues unrelentlessly. It doesn't care about our politics. It doesn't care who we voted for. It just keeps spreading. We're now just over 69 million cases and nearing 1.6 million deaths worldwide. In the United States, over 15 million cases now, and approaching 300,000 deaths at 219. We've hit some new milestones this week where we've had more than 3,000 deaths a day. That's the most we've had since the pandemic started. And remember, deaths typically follow an increase in cases. So in areas like ours, where cases have just been increasing significantly over the past few weeks, we should expect both hospitalizations and deaths to continue to rise, and indeed they are. In California, we have 1.42 million cases and over 20,000 deaths. That has been steadily climbing over the last couple of weeks. We've added almost 400,000 deaths just in the 400,000 cases and almost 2,000 deaths just in the last few weeks. We've now hit 10% positive rate across California, another 29.8% increase in the last 7 days. So that's steadily rising right now. We have not seen that decline for several weeks now. In Fresno County, we are just under 42,000 cases, and we are over 500 deaths at 514 deaths. So we've seen both of those things rise significantly in the last week. In terms of hospitalization, I apparently put the wrong one in here. We now have 460 individuals hospitalized and approaching 80 in the ICU, with just a handful of ICU beds left. So we definitely are experiencing a significant surge. You can see on the right hand of the screen, since my graphs aren't right on the left, my apologies, that we've seen that steadily rise over the last several weeks. And that is the focus. The ICU beds are the focus for the current restrictions, the stay-at-home order, as we talked about previously last week. We continue to experience very, very few ICU beds available in Fresno County and also across our region. So in terms of the tier system, this continues even though we're under a stay-at-home order because of ICU bed availability. We remain in the purple tier if we come out of the stay-at-home order because we develop capacity within the ICU after the mandatory 3-week shutdown, and we remain in the purple tier, then we will re-enter the purple tier restrictions. If somehow, some way we were to go into the red tier, it's our understanding that we would go in the red tier. But right now, based on this particular table, both our positivity rate at 11.3, which is higher even than the state, and our new cases per day at 23.6 remain too high to get out of the purple tier. So why are there these restrictions? I don't know how many of you are on social media, but it's a bit exhausting and sickening to read some of the social media comments on different posts, whether it's, I watched the Secretary of Health and Human Services for the state, Dr. Mark Galley's presentation the other day, and saw a lot of comments in the section where there were comments ridiculing the actions of Dr. Galley and others and questioning the statistics, questioning the science, questioning the facts. Unfortunately, facts aren't facts anymore for a lot of people. But we are trying to use the facts that are available to us to make some decisions. In the midst of an outbreak such as we're currently in, the stay-at-home order largely, per Dr. Galley, is simply because we're trying to mitigate people interacting as much as possible. There's been a lot of questions about indoor versus outdoor restaurants and why some sectors of business are closed and others are not. We're beginning to get evidence around where outbreaks have occurred and where they're more likely to occur. I talked about that a little bit last week. But in the meantime, they're just trying to mitigate people getting together. We definitely know that a lot of spread happens in people's homes. Maybe they acquire COVID elsewhere and bring it into the home, and then it spreads, and that's why we're really trying to mitigate people being in large groups with multiple households where that spread could occur. Evidence is beginning to emerge, though, as I stated, related to the origin of outbreaks. I talked about super spreaders several weeks ago, but there's also evidence emerging around settings. So I'm going to talk a little bit about that today. So early in the pandemic, in March, there was a particular event in the state of Washington. If you'll recall, way back when, Washington was one of the first states in the United States that experienced a significant increase in outbreak of COVID. And one of the events that occurred there that's been well documented was a choir practice at a church. And so at that time, people were attempting to stay apart from one another and practice good hand hygiene and that type of thing. But we weren't strongly encouraging people to wear masks. We weren't considering ventilation. And so they weren't wearing masks. And the area they were in an enclosed space for a prolonged period of time, 2.5 hours. There were 61 people at the event. 53 of those individuals became infected with COVID, and 2 of those individuals died. One single person in the front row infected everyone else. And some of the cases were even suspected cases. So that's one of the first times that they were able to demonstrate that a particular setting was spreading COVID. In April of 2020 in China, they have a well-documented another case where a person who had been in Wuhan was eating with their family. You can see on the left-hand side, there's a little arrow. They call it patient 0. That's the person that they think infected everyone else. That night, the person showed symptoms and went to the hospital. In the right-hand corner of the top of that rectangle is an air conditioning unit, and there was no natural ventilation. So air conditioning was the only way that air was moving in that restaurant. After the meal, 9 other customers were diagnosed with COVID. And in particular, they noticed that those tables closest to the individual who became infected were more than a meter away, so more than 3 feet away. Some were 14, 15 feet away, but only in that area were people infected. There were people at the other 2 tables, they were not infected. And so they really feel like length of time is critical, as well as that proximity. So the families or the people sitting at the other 2 tables where people became infected overlapped with the patient 0 by an extended period of time. And then those at the tables where people didn't get infected only overlapped by about 18 minutes. So researchers really think that air conditioning unit also played a critical role. Air was recirculating continuously between those 3 tables. And so they believe that the individual on the far left who was infected, that air was coming around and around and just recirculating with those microscopic droplets or aerosolized particles of COVID. So in restaurants, recommendations came out because of this around opening windows to increase ventilation, trying not to have high background music so people don't have to talk louder. I know in many restaurants I've been in, Sometimes you have to talk really loud even to hear give your order to the waitress who's standing right there, or the waiter. Avoiding recirculation of air, so that air conditioning unit that was recirculating the air, you would not want it to recirculate air, but always bringing in fresh air. Always using air filters. Reducing the size of indoor gatherings, so some restaurants opening up at reduced capacity, that was another recommendation. And then increasing that distance between people and having outdoor events as much as possible. So this was a specific event where people did get infected, and recommendations came out of that. And I think it's important for us to keep that in mind, that these are science-driven recommendations. The next one is an office building in South Korea. So on the left-hand side, you see the general structure, a large multi-story building where the staff worked in a call center, where they worked together around a workstation where there were 13 workstations around a table. And at some of those desks, such as the one illustrated on the right, 9 of the 13 employees tested positive. So they had many of these different tables, and the next slide will illustrate that. So another office on the left-hand side, an enclosed space with 137 workers, and the people all around the table in close proximity to one another. 79 of the 137 workers tested positive on this floor. And really having that same space over a prolonged period of time, they believe played a crucial role. And this was on the 11th floor of the building. But interestingly enough, on that 11th floor, very few people outside of that large shared space did become infected with coronavirus, even though they shared lobbies, elevators, and other communal areas like break rooms and such. And then only 3 people tested positive on other floors. And they don't know if those people were infected by the person on the 11th floor or not. But really important to note that this type of study, again, shows that when you're in the same area for a prolonged period of time, you're much more likely to get COVID than when you're even in the same building but another office. So with office recommendations, natural ventilation, so opening windows where you can, avoiding concentrations of employees either in meetings or in food and drink areas, break areas, keeping staff distance by combining telework and flex time, avoiding physical contact, no sharing of material or equipment between coworkers, and then organizing workstations to maintain distance. These are all recommendations that we've put in place here, along with a few others such as signage and the plexiglass barriers. We've went to remote work, we're flexing people in and out, trying to keep people out of the building and such. And so these were office recommendations that came out of that particular incident. And then just this last week, a new incident that has been heavily researched emerged, and this also occurred in South Korea. And just a little reminder that some of these examples are from other countries where there is a lot more control that goes on, a lot more restrictions. So we have a lot of we'll say divisiveness around the restrictions that have been put in place, or the recommendations that have been made, or the public health advice and guidance. Really across the United States, we've had that protests and divisiveness. Well, in some other countries, you don't really have a choice, and there's a lot more restrictions around when you have to quarantine, and where you quarantine, and where you isolate, and how you account for your location, and that type of thing. So there was a particular high school student in South Korea, a teenager, and it was at a time when South Korea really had the coronavirus under control. So they had very few cases of coronavirus. Their monitoring was quite intensive and controlling. And this particular high school student in a particular region turned up positive. And so they really struggled to understand how she got coronavirus when no one around her had coronavirus. So they went back and looked at mobile phone data, the geo mapping. They looked at video footage of different places she had went. They genome sequenced the COVID-19 that she had to really all of those things together to draw some conclusions. They also recreated some of the situations that they were able to observe her in from when she got COVID and her recollection in the past. So what emerged was that there was an individual from another region, and they weren't really allowed to travel between regions at that time, but it emerged that a woman who was positive for COVID had traveled to this teenager's region, had attended a work event in a building where the teenager had also been in a restaurant. And so this illustration here shows the traffic flow. It shows where people were located, how they traveled through the space. It showed visiting time, and it showed airflow for the ventilation systems. And essentially what they determined was that the woman was infected when she was in this restaurant, that the teenager and one other person who was also present in the restaurant later turned up COVID positive, and they were able to demonstrate based on air conditioning, airflow, and the direction that people were sitting. So the individual who had COVID was near the air conditioner blew the air past that person and into the pathway of these two other people. Both of them were facing the direction the air was flowing. There were other people in the restaurant who were not facing that direction who did not develop COVID. The thing of most note that's really been piquing people's interest is they were able, through the cell phone data and all of that, to demonstrate that these two individuals were never closer than 20 feet, and they had that proximity for less than 5 minutes. So we just know that anytime you're in close proximity, maybe even more than we think, and in a situation where, like eating, where you have your mask off, even if people are wearing masks generally, usually when we're eating and drinking, we take our mask off, and then depending on the ventilation and where you're sitting and such, you could be at risk for getting COVID. So I share all of this with you really to emphasize that it's hard sometimes to make sense of the recommendations. Sometimes I struggle too. I wish we could have outdoor dining right now, but I appreciate that we're trying to come up with recommendations that can slow this down, that can limit people's interactions with one another, mingling for long periods of time, just to slow the case rate down to keep people out of the hospital. So a quick little vaccine update. We are going to receive 7,800 doses. I believe today they're approving the vaccine for use in the United States, and those doses will get to us, we hope, by next week. People are working fast and furiously to both develop the storage plans as well as the dissemination. Our team within the Department of Behavioral Health is working closely with public health on that distribution plan. We are part of that vaccine distribution work group. Helen Herrera is our representative on that. And some of her team and a couple of other people in the department likely will be tasked with assisting with developing that work. Healthcare workers and residents of long-term care facilities are prioritized in Tier 1. And long-term care residents, this is important to note, I learned this week, their doses don't have to come out of that 7,800. The state has developed a different distribution plan for the doses for long-term care residents, so those have already been taken into consideration when the doses are given to each county. And so we get to focus on the other priorities within those tiers, and the state will manage long-term care residents. So what have we learned? In any setting in which people are together for a prolonged period, there are measures that should be taken. Again, and you know, the bottom of this upside down pyramid is the least effective, all the way to the top, which is the most effective. So mandatory mask use, while great, will not be effective if you're in close proximity to someone for prolonged periods of time. And so that's why we really try and put what we call administrative controls, which is, you know, just changing how we do our work to reduce contact between people, whether that's having people not work in the office, reducing the number of people in the office, making sure people are spread out, not really having to come together to exchange material or such. And then creating engineering controls where we create physical barriers between people, including the different plexiglass and such. And then the physical distancing, which can be everything from where we locate desks and such, or offices in proximity to one another, as well as teleworking and just reducing the number of people in an office. And so we continue to do all of those things, and we know that they work. Research has shown that they work. So those public health precautions we do have to follow. Remembering that masks are our last line of defense, and do not, whatever you do, come into work or go out in public or go to a friend's house or attend any outside of your home activity when you're sick. If possible, get tested. I know a lot of people are afraid to get tested. They don't want to know that they have COVID maybe, or they're afraid they'll have restrictions, but we're not going to get control of this unless people follow these precautions, including if you're sick, if at all possible, and you can get tested. That way you know what precautions you need to follow. If you don't have COVID, then you can not worry about having COVID. But if you have COVID, you can isolate yourself and you can have other people quarantine who may have been exposed to you. There is new recommendations coming out, hopefully today or tomorrow, from our public health officer that will reduce the amount of time you have to quarantine if you've been exposed to COVID. And so currently you have to quarantine for 14 days from the last exposure you had to a positive individual. And the new recommendations will make that closer to 10 days or 7 days if you've had a negative test. So look forward to that. And we're hoping that those reductions in quarantining will make it more likely that people will get tested and more likely that people will follow quarantine orders. We do expect telework to continue through March, at least. The new employee check-in is almost ready. We had a little hiccup last week, I think we remember. And then we continue to have ongoing testing available to county staff and their families. I think we had over 140 people take advantage when we had it on one of our sites here at the Hawk last week. I got tested, I was negative. Anyhow, look for those links in your emails to get signed up for that, or to have a family member sign up for that. And remember, if you're symptomatic, please alert your supervisor. We are keeping track. We're required by law to keep track both of where people are working, even if it's at home, and we're also required to keep track of when someone has COVID. And we do have new notification requirements that we have to make when to notify other people who might have been in those work areas. I will also mention that the state of California is rolling out today a new feature. It's something they partnered with Apple and Google on. And if you have an iPhone, and I think it even works if you don't have an iPhone, there's a function within the Apple products that you can turn on. I turned mine on yesterday. Because our iPhones do have geo mapping, it can let you know if you've been in close proximity to someone who tests positive for COVID later. It could be someone you've never met. It could be someone you don't know that you didn't know you were anywhere near. So for instance, if I, on my way home tonight, go by Trader Joe's and pick up some bananas and milk and half, which I often do, and for whatever reason I linger in there, or I'm there for 5 minutes, it's a really long line waiting to get in, what have you, and someone near me later tests positive for COVID, I'll get notified that I was close to someone. I think it will tell me when that happened, where it happened, and then you could use that information to be informed. I know that there are some people who would be concerned about revealing data about themselves. It's my understanding that it's anonymous, but you have to make the decision for yourself in terms of whether or not you would find that type of thing useful. It's certainly voluntary, and I want to thank Jolie Gordon-Brower for bringing that to our attention. All right, the holidays are coming up. I know it's a time when we all look forward to being with our families, and I'm going to strongly encourage you to rethink your holiday plans. This is a short-term sacrifice for the long-term greater good of our community. The vaccine's coming, but it's a pretty small amount of doses to begin with, and so it's going to be some time before we get that very much sought after herd immunity. So the more that we can all do to slow this down, to protect the integrity of our healthcare system, the better off we'll be. So join me in wearing your mask, keeping your distance, and really, really working hard, whether it's mandatory or not, to not mingle with other people, not have big gatherings, especially when multiple households are together, and do our part to try and reduce this outbreak. So with that, I will look and see if I have any questions. Someone said getting tested is super easy and free and gives me great peace of mind. Me too. I've been tested 4 times now. One time I even drove all the way to Mariposa to get tested, so it wasn't as easy. But as time has passed, we actually have significantly increased both the options for getting tested, the ease with getting tested, and actually I got my results much quicker the second 2 times than the first 2 times. The first 2 times when I got tested, it took probably a week or so to get the results, and both of these times I had my negative results within 3 days, so that was awesome. Someone else said testing was very easy. I don't seem to have any other questions, but let me see. Oh, no questions. Oh, the Android users can download an app for that automatic contact tracing of you, I guess I call it, and it's called California Notify, or CA Notify. And you can go on your phone and download that app if it's something you might be interested in. And that's a way for you to give yourself additional peace of mind if you're interested. Completely voluntary, and assurances that your privacy is assured. All right. Then it says the other person who tested positive that was within your proximity via phone alerts will have to have that geometric option turned on as well. I believe so, because that would be the only way that you would know that they tested positive. So the more people that participate, good point, the more chance that you would be able to know that. And yeah, someone else said, you don't have to download an app for Apple. What you actually do, I did it, it's real easy if I can remember what I did. Do you remember what we did? There's something in my phone I went to, and you just turned it on. And it might be, I don't remember. Maybe accessibility. Anyhow, I'm sure if you look it up, you can figure out what to do. It's just in your settings, and it allows you to just turn that feature on, not an actual app that you have to download. All right, I don't see any other questions, so with that, I'm going to end the presentation today. I believe next week we have an all-staff meeting, so I'll be sharing a lot of this information that I typically share in my update, but we won't have an update because the all-staff meeting will replace that. So please have a safe week, keep yourself and your family safe, follow the precautions, and let's do everything we can to get out of this outbreak and get ourselves to that vaccine. All right, I'll talk to you later.